Okay, I'm gonna kick things off again and ask everybody if you can take a seat. Greg has been very kind and patient and waiting for us. I told him that we were running a couple of minutes late. So um, I wanted to mention before I read Greg's introduction that he very graciously was willing to come to Buffalo. um, and when we started to see the number of registrations heading in the direction of so many people joining us virtually, which does make a lot of sense for people that are caregiving on the full spectrum, I reached out to him and I said, please don't drive 5 hours in each direction when you can do this just as effectively online. So there he is up on the big screen. But please join me in welcoming him. Greg, as many of you probably know, and he's actually been very kind and been with us here in the past. He is the director of the New York State Office for the Aging. In that space, he oversees programs, policies that serve more than actually almost 5 million older New Yorkers through families and caregiving. Recently, he has taken on leadership roles, including chief of staff and legislative and policy director for Assemblyman Steve Engelbright. And he's also been executive director of the New York State Alliance for Retired Americans. He holds a master in social work with a specialization in gerontology from Syracuse, SU, not too far down the road from us. And most recently, and I think this is why we thought it would be great to have him speak with all of us today, is that he really led a very large project, a statewide cross-sector team in developing New York State's master plan for aging. I think there are a few people here in the room that actually participated in that process with him at the lead. It's a comprehensive forward-looking roadmap to ensuring that every New Yorker can thrive at every stage of life, and especially in our latter years. What's especially notable when I was doing a little bit of research about this and looking over his plan and trying to comprehend it all is that we, through his leadership, are really paving a path in New York State as compared to many other states. Very few states across the country have done something as comprehensive as what he has taken on. So today he's going to share elements of that plan with us, its vision and the priorities and how it can be a resource for all of us. So thank you, Greg, for being willing to do this again and joining us here in Buffalo virtually this time, though.
Well, thank you so much, and thanks for the intro. I love Buffalo. Little known fact, my aunt was a Buffalo Bill cheerleader in the 1970s. So that's my claim to Buffalo, but I love it out there. And it's great to be back, and I thank you all for the invitation to have me. This is the title of this is really apropos in terms of what you're trying to get across. And I do want to shout out to Randy Hoke and the team at Aries Senior Services. I know they're on the next panel and can get into a lot more detail on community resources, the kinds of things that we do throughout New York State to help older adults and their family members remain as independent for as long as possible. I mean, that's really the goal here. But including balancing care for parents and children, it's also about balancing care for self. And I know that you guys had a caregiver panel this morning. I want to talk about that as well. So I will talk about the MPA. It's important, but I always like to put some context behind this, so we're not just jumping in the middle and not understanding, the why. Like we can all talk about what we do for a living in our businesses, what have you. We can talk about how we do it, but we often don't talk about why. What I can't talk about today because there's no time is the impact of HR1, taking $1 trillion out of Medicaid and what that's going to mean for long-term care, healthcare, people losing their health insurance, their bills going up by $9,000. I can't talk about $300 billion coming out of the SNAP and what that's going to mean for people's nutrition because we know food is medicine. I can't talk about the HHS budget proposal, which impacts my agency and health across this country. And then, of course, the government shutdown. So, that's for another day. But why I raise those, because it's going to become even more difficult for individuals and more pressure on already pressured families. I caught the tail end of the last one, and the woman that spoke is spot on. What people are going through currently is already stressful in every facet of their life. And unfortunately, it's only going to get worse. And the fact that we're having this conversation in 2025 is crazy. How do I advance my own slides? There we go. So I'm going to do it this way so I can advance these. So this is a banner year. I mean, look at the anniversaries on some of the most critical and important things that support families, Social Security, and older adults. And the fact that we're having conversations about, large scale rollbacks, and what the impact is going to be on older people, to me, I think is a crime. But this is a milestone year for many, many important social programs, economic programs that have helped people, again, 60 plus years, 90 in case of Social Security. I like to talk about the why. We grow up in a culture that is ageist, and I'm just going to say it. We do. Whether it's in the workforce, how we treat older adults, our parents, et cetera. We have been taught, directly and indirectly over years and years and years, decades, centuries, that older adults are expensive, they're frail, they take more than they give, they're not contributors. That is absolutely false. And the context, I think, is really important to do a level set on who exactly we're talking about. So if you look at people 50 and over, the reason I pick 50, now the population I serve is 60 and over primarily, and then caregivers. Those are the folks between 50 and 59. Obviously, there's younger caregivers, but that's kind of the bulk of it. So we use 50. It's an incredibly important population intellectually, socially, and economically. And that becomes part of the why. Why are we doing this? Well, mostly the US household wealth comes from this population. Their taxes and what they're supporting in terms of local, state, regional, and national economy is unquestioned. It's huge. They spend more than younger individuals in all these different areas. And this isn't pitting an older person against a younger person. What it does is tells a different story than what we've been told our entire lives. They're the number one volunteer group, number one givers to philanthropy, number one entrepreneur group. It's not the 20 to 29s, it's the 50 plus. Largest group that provides donations, and they're a huge tourism block. Their spending supports almost 90 million jobs, 44% of employment. And when you look at New York State, right, about 36% of the population, GDP are the goods and services we produce, because many people are still working in their 50s, 60s, 70s, and 80s. 43% of our state's GDP comes from the population, 719 billion. Spending supports 6 million jobs. Their work lives, 482 billion in wages and salary. They pay 40% of all taxes, state and local, $72 billion. And I'll tell you why this is important in a second. New York State retirement system pumps 10.6 billion into New York's economy. Non-public pensions, 30 billion, 70 billion in Social Security. We have almost 1 million volunteers providing almost 500 million hours of service, holding up 33,000 not-for-profits that if you had to pay for that labor would cost 13 billion. Home ownership rates are extraordinarily high. Why does that matter? We're a home rule state. So your local property taxes that come from your home pay for schools, they pay for Medicaid, they pay for sales tax, support local businesses. And then I'm sure you went through all the numbers this morning on caregivers. We have 4.1 million that if you had to pay for that, and would most likely be through Medicaid, would cost about $39 billion a year. So that's the why. Why are we doing this? Because we want these contributions to remain in the state. We want to start if somebody ever needs the assistance of us or you or anybody else, we want to start that much earlier. The last panel talked about us as a society not planning. We don't. We'll spend more looking at, specs on a refrigerator than we will planning for, our future. And that really is because people are fearful. And we're ageist. We just are. And that's something I think we all can contribute on how to combat that. So that's kind of the why. Why are we doing this? Because this population is really, really important. We know what makes up good health. So when we talk about the master plan, this isn't our first rodeo. We started this work with the Department of State and Department of Health back in 2007, before there was anything called master plan or age-friendly communities. We started this understanding that the built environment, where our healthcare costs come from, really don't have much to do with the diagnosis, some genetics, but it's our individual behaviors and the environments of which we come. And that's what this is all about, which is why we became the first age-friendly state in the country in 2018, why we have age-friendly health systems, why we have a prevention agenda, why we're pushing health across all policies, because we understand that older adults, just like younger people, touch many different systems. And we have to bring all of those systems together in order to, serve people holistically and not whatever the driving crisis is at the time. So I'm sure the folks from Erie County will talk about this, but we do a comprehensive assessment for all of our customers. I started as a case manager 33 years ago in Monroe County. These are the kinds of things that we are working with families, individuals, and or their families, so that we can develop a comprehensive plan with them so that, again, we can maintain that independence. And these are the services that we provide all throughout New York State. I know Erie County will talk about those. So, and I'll make this slide deck available if anybody is interested in it. So our four primary groups of customers. Number one, these are the healthy and well, but might need some information, some assistance, right? And there's millions, 4.84 million people over the age of 60. We have, chronic people with chronic conditions are going to cost $800 billion by 2040. They're preventable and they're manageable. It doesn't cost a lot to do that. Our primary book of business are those who are at imminent risk of Medicaid spend down and nursing home placement. So our average client is an 83-year-old low-income female, lives alone, 4 to 10 chronic conditions, 3 ADL limitations, and 6 IADL limitations, meaning they are nursing home eligible and Medicaid eligible right now. And we're able to keep them at home with the comprehensive, services that I just showed for 5 to 7 years for 1/15 the cost of nursing home care, $9,000 a year. Now, nursing homes are always going to be an important part of the continuum, but it shouldn't be the first line of defense. And that's kind of how we've structured this as a society, that is what happens when people go to the ED department or hospitalization, they wind up going into a nursing home for rehab, or there's not a safe discharge, so there's no other place to go. But the numbers don't add up, which is why the MPA is so important. Here's what I mean by that. We have 112,000 licensed nursing home beds at 88% capacity. That's 98,000 filled beds right now. We have 4.84 million people over the age of 60 and another 3.7 between 50 and 59. So the game, and it's not a game, but where people want care, where it's least expensive, where we can do it earlier by coordinating our efforts is in the community. It's just that simple, and it's so much more cost effective. This is just a slide that I love because Medicare has put, who the high utilizers are and what they cost. So, 5% of the top spenders for Medicare, 400 billion a year, have 1 to 2 chronic conditions and some functional limitations. The reason I told you about our average client is a lot more frail, has many more chronic conditions and functional limitations than the top 5% of Medicare spenders or even the top 20%. And like I said, we're able to provide the assistance and the care that they need in the community to stay there. So, you can't put a plan together. How do you know what it is that people may want, need, how they feel about themselves, what they think about their community without asking them? And we did that for the first time in the spring and fall of 2023. This was a huge undertaking. What I'm going to show you briefly is what the state report shows, but we have the same exact report for every single county. So if you're interested in Erie County or Niagara, Chautauqua, Genesee, wherever you may be from in the state, you can simply go to my website, aging.ny.gov, or you can just put POLCO, P-O-L-C-O, in there, New York State, and it'll bring you right to the webpage. I want to highlight this number here, right? Because any of you who might be researchers, we see polls all the time. 50% think this, 25% think that. And then the small print under the poll will tell you what the sample size is. And it's anywhere between 250 and 1,000 people. We had 27,000 responses to this survey from all over the state, people from 60 to 104, asking about, again, how they feel about themselves, about getting older, what they may or may not need, what they thought about the economy, their community. Do they plan on living there? What resources did they know that they existed? So I'm just going to go through this very, very quickly. And again, I'll make the slide deck available. But again, I go back to most older adults consider themselves healthy, very healthy, active, and engaged. It's society that's telling us something different. And this backs up all the data I have ever seen. Somewhere between 72 and 82% are good. And we want to keep them that way. And I think that we can. So it rates things like your overall community. And again, this is the state one. They're all going to differ. So Erie County's data is going to look different than this, but wanted to show you what was in there. It evaluates the overall economy, what the housing looks like and affordability, transportation and ease of travel. It's going to be different again in Erie County than it's going to be in Steuben County. The economic opportunities people think they have or have access to. Do they have meaningful engagement and recreation? And again, this is a snapshot. These are 164 pages of information for every single county. And what it measures is livability, age friendliness, concerns about daily activities, availability of resources. Do they know what's out there? And there's some really interesting things in here when you do the kind of the deeper dive. Services of care and access, social isolation, crime and social inclusion, caregiving. So there's all of this stuff in here because we asked people what it is that they are interested in and how they feel about themselves and community. And that's the only way to develop a plan. You don't want people sitting in Albany in a tower that never get out to the community, that don't talk to people to make policy and make plans. You have to get out to people, understand exactly what it is, where they're thriving, where they're struggling, and where they're in crisis. I did want to talk about caregivers a little bit because the name of this is about how you balance this. Sandwich generation, that's me, taking care of my kids, my two older adult parents, and why it's so important for self-care. But we started an initiative several years ago with the Department of Labor to understand better working caregivers. One of the main reasons people didn't go back to work after COVID was because they were caring for somebody. And so we, again, with the Department of Labor, used a very, very simple survey to understand what people like me were dealing with when going to work. So not only am I working full time, but then when I go home, I'm caring for folks so that we can, again, provide some of the supports that we offer for free. And I'll show those to you in a second, to working caregivers, whether they're in the public sector or the private sector. MetLife Mature Market in around 2005 actually put a number on lost productivity and cost to businesses for caregiving. Now, this is 20 years ago. And what they estimated through absenteeism, turnover, people, going from full-time to part-time, leaving their jobs, all of that cost businesses over $60 billion a year. That number is going to be way higher today. So the purpose of our initiative is to let business leaders, the HR departments know that their employees are caring for people, and it impacts their jobs. And again, I'm sure you went through some of the statistics this morning, but take a look at this. These were two separate surveys that were done by the CDC during the pandemic. We know that HR departments know that some of their employees are dealing with this. They don't know what to do. 75%, people trust their employer to provide accurate information. 70% of working caregivers reported at least one mental health symptom: anxiety, depression, suicidal thoughts. That continues today. Many report having to rearrange their work schedules, so on and so forth, and I'll show you that. 55% don't self-identify as caregivers. That is really, really important. So what we do is we focus on tasks, and we really have to come up with a different term or word. What I usually say, it's not a good acronym, is people who are providing uncompensated care to somebody else, a loved one. Because when you use the word caregiver, people don't self-identify as that. They identify as a spouse, as a son, as a daughter, as an aunt, as a neighbor, as a friend. So we focus on tasks, not the word caregiver, so that people can help self-identify. And when we do that, we increase the self-identification by 450%. 50% use food to cope. That's going to have an impact on your own health. 33% use substances to cope, compared to 6% of the general population. 31% contemplated suicide. And then there's an impact on the workplace. So what we did is we did a state agency analysis. The non-state agencies were folks like JP Morgan, Volvo International. We sent it out to all of Department of Labor's list of folks that are registered to have business in New York State. And it's really very, very interesting. And this can be customized to any organization. And we have this survey if anybody's interested to understand what your own employees are doing. But you look at the age. We traditionally think a caregiver is a 55 plus female taking care of a parent. Certainly that's a large group. But you can see the breakdown, right? 9%, almost 10% are in their 20s. 36 to 55 is like 50%. So it's not generally who we think. It's really everybody. We have 350,000 grandparents who are taking care of grandkids. We have grandkids taking care of their parents, taking care of their grandparents, taking care of their siblings. So there's not a one size fits all. The hours of care, I think, is stunning, right? Imagine working full time, whether it be 37 and a half or 40 hours a week, and then spending, you got 32% that spend more than 15 hours a week caring for somebody else. I think that's stunning. And recognizing that and being able, again, to provide supports to help them in their caregiving journey is a priority of ours. How long have you been caregiving? It's not a short-term thing for a lot of people, unfortunately. So you're looking at only 15% less than a year. And the majority are years and years and years. And again, with advances in medicine and people's chronic conditions, that trend is going to continue. What are the types of things that they were doing? Driving to doctor's appointments. Well, that's going to increase when you constrict the health and long-term care system under HR 1. Arranging meals, grocery shopping, so on and so forth. So we have all of this listed. And I'm not surprised by it because it's exactly the things that I do at work during the day, unfortunately, and many of my staff do as well because they're caring for somebody else. But then it's the impact, right? And this is the real aha moment, I think, is what does it mean for yourself and what does it mean for the place that you work? Arriving late, I do that. Leave early, I do that. Miss days, I do that. Taking leave of absence, unable to focus, responding to emergencies during the day. Consider changing employees or quitting altogether. So I just wanted to kind of go through this because we don't really talk much about working caregivers. Now imagine you're a nurse or you're somebody in direct care, social services, adult protective services, aging. That's already extraordinarily difficult job dealing with dysfunctional families, dealing with difficult individuals, and then going home and doing it again 24/7. So it's really difficult. So what we've put together is a couple of things. And these are active links. So when I send the slide deck, if you click them, they will go right to the document. So we developed a caregiver guide to the workplace with the Department of Labor that has a whole bunch of information for caregivers, from financial assistance to other types of support. The caregiver guide video, as I said, was designed to focus on the tasks, so people can self-identify much easier. It's about a 5-minute video that really, again, marries the things that I'm doing. I'm not doing alone. Many people are doing it. It's the tasks. If anybody's interested in this survey, you can customize it for your own employees and get the same data and information that I just showed. 2 free tools that we have. One's called the Caregiver Intensity Index. We partnered with Archangels out of Boston, Massachusetts. It takes about 2 minutes. There'll be a QR code on the next screen that asks about 22 questions where you are in your caregiving journey and puts you in one of 3 categories. Green, I'm doing good. Yellow, there's some issues. And red, I'm in crisis. Provides the areas where you feel most supported and the areas where you're struggling the most, and then connects you with all these resources that we provide, that they provide, and so on. So I'm going to provide you that QR code in a second. Share it with whomever. It can be taken, every day, once a week, etc. But it's a really, really important tool for individuals, not only to get the support and resources that they need, but to understand where they are. The second is a partnership we have with Trualta. It's called the Caregiver Training and Education Portal. This is free for any caregiver as well. It's an evidence-based tool that provides training in a variety of different ways to the caregiver, depending on who it is that they're caring for. So the content's going to be different if I'm caring for a younger person with IDDD or I'm caring for an older adult with Alzheimer's disease. We've had this partnership for 3 years. The data now and the metrics that we have is for folks that utilize this tool, there's a 20% reduction in hospitalizations and a 15-month delay in nursing home placement by building the skills and providing the supports that a caregiver needs for the person that they're caring for. Okay. That's the QR code. That should work. But again, I will send this out. I really, really encourage you guys to look at the Caregiver Intensity Index by Archangels and certainly Trualta. These are free. I pay for them. No, there's no cost to anybody in the state of New York to use these. All right, let's talk about the MPA. So as I mentioned, this isn't like our first rodeo. The MPA is kind of the next iteration of Age-Friendly New York to really understand, again, why we're doing what we're doing, how valuable the older population is, that there's interventions we can provide in the community to help that, and that aging doesn't start at a certain age. You know, the one downside to having the Office for Aging and AARP involved in Age-Friendly New York and Master Plan on Aging is people think it's all about older adults. It's not. You start aging the day that you're born. So if we can, provide supports and other types of services for children, they're going to grow up healthier. For people in their middle age, they're going to age healthier, and then certainly a plan for older people. And I think, if I was given this presentation 4 months ago, I would say it's really, really important. I'm giving this presentation today with what's happening at the federal level. It is that much more important that we have a coordinated effort that not only supports older adults, but families, because they're really going to be struggling over the next couple of years. So this was a recognition, again, value of the older population. It's a short-term, medium-term, long-term roadmap that's been developed for policymakers and others so that we can listen to what it is that people are saying and respond to that. Again, good policy doesn't get made from an office building downtown Albany in the concourse. It gets made by people whose lived experiences we need to listen to, and that's really what this process was all about. So what did we do? It was about a 2-year effort, and it was an effort. I can tell you that. We've got 400 pages of recommendations, over 100 separate proposals. We had 20 public listening sessions in town halls around the state. 430 stakeholders were engaged. Over 800 meetings were held to get people's feedback. We developed a council of state agencies because, again, people don't just live in one agency. They touch many, many different systems. And so you got to bring everybody together so we can leverage assets the best way possible. We had a stakeholder advisory committee. There were 8 subcommittees with 34 work groups. We did 10 industry roundtables. And the goal, again, was not to have me and my staff or the health department and their staff or the Department of State and their staff write proposals that we think. This was us facilitating a public process to get those recommendations from individuals and experts in their various fields, and then put it together in some type of meaningful way. And that's what we did. It was organized really into 9 pillars. And this was really just to try to make it make sense. How do you organize 100+ proposals? So we tried to group them. Affordability and basic needs. It's really important always. It's going to be much more important in the months to come. Informal caregivers and working caregivers, modernization and financial sustainability of healthcare, prevention, wellness, promotion, housing access. I mean, all the things that you know and I know matter to everyday people, the conversations that are being had at the kitchen table. And I just pulled out some of the snapshot of recommendations. Like I said, there's over 100 of them, but just to show you the diversity. The overwhelming recommendation in there was to fund my organization. And again, got to thank the governor not only for her leadership on writing an executive order that establishes the MPA, having 2 consecutive incredibly great budgets that not only impacted older adults positively, but mental health, public safety, affordability, housing across the board. But we had our largest investment in my agency in New York State history. And again, want to thank publicly Governor Hochul. She's been a huge, huge supporter of us. Incentives for geriatric specialists. I pulled that out because I wasn't going to talk about HHS's budget. But HHS actually proposed to eliminate all 16 incentive programs across the country to get people into healthcare and long-term care, and proposed to eliminate the only one that funds geriatrics. So I thought that was great. There's a lot of support and recommendations on supporting caregivers. Food is medicine. Again, you have this recommendation because we know how important good nutrition is, and at the same time, cut SNAP by $300 billion a year, which is going to be 6 to 9 billion less meals per year. Creating an Office of Older Workers. We actually did this administratively with the Department of Labor. That is in existence. Housing workforce training, a lot of veteran support in here, elder abuse and financial fraud and scams, proposals to mitigate that. Creating an Office of Benefits Coordination. I really love that. One central place. Let's just take veterans for a second. They're eligible for over 105 federal, state, and local benefits, just veterans alone. When you have them sifted out through all these different agencies, it's hard to understand what's available, how you access them. So I really like that kind of a one-stop shop. Expanding Alzheimer's disease, dementia, and training, strengthening hospice and palliative care. We rank last in the nation in access to hospice and palliative care. Better promoting Medicare wellness visits, increasing vaccination rates, increasing the housing supply through local zoning incentives. This is really important because Governor has a $25 billion 5-year housing plan, but we're a home rule state, which means you don't build any housing without the municipality agreeing to it, either through their planning and their zoning. So the governor has put up $50 million the last 2 years to incentivize local governments to make the zoning changes that they need to in order to build housing. And I think that's spectacular because that's the only way it gets done. Strengthening home modification programs. In upstate New York, the average housing stock is 75 years old, and we know what they look like. So it's a very dangerous place, but there are things that we can do within the home to make them more safe and for people to navigate and hopefully prevent falls and trauma as a result of falls. Increasing access to technology, combating ageism, and so on and so forth. So where are we now? The report has been released, obviously. There's going to be some things that are in there that we can do administratively. So we are working with other state agencies to identify those things that are doable that we can just do, like the Department of Labor and the older worker, new division of older workers in the Department of Labor. There's going to be proposals in there that have a fiscal on them. That's going to be then something that the governor, governor's staff, DOB, and the legislature will deliberate in upcoming budgets. And then there are going to be things that potentially need statutory regulatory change, and they will go through the normal process as well. So I think, the low-hanging fruit, or what are those things that we can just start to implement that we don't need any changes that make sense. And then there's going to be others that are going to have a much larger conversation. But it's not over. This is not done. It just was released. It's going to be a living document that's going to be amended. Things are going to change over the next 4 to 6 years. So things that might have been doable, might not be doable. Things that were not doable, then, could become a priority. So we really don't know. But it doesn't mean that if there's not a proposal in there, that it's too late. So I was at a conference yesterday, and this woman was very, very passionate about hoarding and mental health, and she's spot on. It's definitely a problem, but it wasn't raised in the master plan. And so that's something I can bring back and bring to the mix. So there's going to be a lot more conversations on the master plan in the coming months, in the coming years, through the legislative session and through the budget session. But I think the first thing is figuring out where we all are. We're in a government shutdown. There's 13 agency budget bills that need to be passed. That's what didn't get passed, that fund, agencies like mine, the Office of Mental Health, the Department of Health, et cetera, to kind of figure out where we're going to be in 2026. Because we just don't know at this point. Is our funding going down? Are we going to be able to expand? What other types of programs are they looking to eliminate? Are they going to continue to withhold dollars that Congress already appropriated? So there's a lot of uncertainty. But like I said, I think it's as important now as it ever was to have an MPA and to put the context around it. So thank you all. It's a pleasure being with you. I wish I was there in person. And again, appreciate the invitation. So thank you.
So, do you have a minute or two to take?
Of course I do.
You've got some cheers going on across the screen. Do you have a minute or two to take some questions?
Absolutely.
Yes. Mark from Spectrum is going to be your first question.
Hey, Mark. How are you, buddy?
Good, Greg. How are you? Can you hear me okay?
I certainly can.
All right. I guess, you talk about the sandwich generation. That's why we're here today. We've heard how real it is
I lost you, Mark.
Okay, can you hear me?
I can hear you now. I missed.
Okay, that's okay. How real is this sandwich generation issue from where you sit, and why are forums like this so important, not only to Western New York, but all of New York State?
Oh, it's absolutely real, and I think you can see it in some of the working caregiver data. You know, the individuals who are caring for somebody else, and it's not always an older adult. It could be a spouse, a younger person with MS, early onset dementia. So yeah, it's a huge issue, and it does affect economic security. It affects your own health, and forums like this are really important, Mark, because again, I caught the tail end of the last panel. We do not do well as a society in planning for our own futures and planning for those that we care about. I'm going through it now literally with my mom. No healthcare proxy, no will, no estate planning, no power of attorney. She just had a mini stroke and now is kind of on her own at 80 years old. And these are conversations, again, doing what I do, I've had for a number of years, but just did not get done. So I think, understanding, and which is why Erie County is going to be on the next panel. There are a whole host of community resources, not only that we offer, but that we partner with. And, Mark, you've been covering us for a long time. We have 1,242 community-based organizations that we work with. But there are so many more within the community that people don't know about. And unfortunately, our system is very much crisis driven, meaning people don't approach us or see us until they're in a crisis. And forums like this are critical to try to de-crisis this and understand that there are some simple things that we can think about and do to protect ourselves and our loved ones and not wait until it is a crisis.
Mark said thank you. Oh, Dr. NYS.
Hi, Greg. On? You hear me?
I can hear you. Hi.
Hi, I'm Katya Noyes. I want to first personally thank you for providing us a letter of support for our PCORI application. We're very, very grateful for the support from your office and hope PCORI will take it seriously. But today, so listening to your talk, I'm very impressed by cross-disciplinary, cross-agency work you do for the aging. It's actually one of the unique, in my experience, one of the unique programs that combines medical, social, legal, and lots of other services that we typically do not do. I am really curious if Department of Health, New York State and nationally, do they take your experience seriously? Do they learn from this framework? Because this is the only way to provide seamless, comprehensive, coordinated care to the people who need it the most.
Yeah, thanks for that question. And you're spot on. We're the only state in the country that have a statewide, what's called an EMDT, an enhanced multidisciplinary team approach to combating and mitigating elder abuse, frauds, and scams. Everything that we should do, whether it be healthcare, social services, what have you, should be an EMDT model. And so what you just described really is that. It's pulling in the right people. And I got to be honest with you, I have to do that. It's not only is it the right thing to do, but I have to because unlike some other programs and services, there's an endless supply of funding because they're entitlements, right? We are not that way. We are on the discretionary side of the ledger. Our county offices get a certain amount of fixed budget, and they have to stay within that budget over a 12-month period, which is extraordinarily difficult to do, and they're amazing. But I love data. I'm a geriatric social worker that loves numbers. So I'm just going to give you a couple of examples why we do what we do, and I'll then answer your question. We have, 70% of all the state's veterans are over the age of 60, 440,000. I have 32,000 veterans on our caseload. So we have to work with the Division of Veteran Services. The Office of Mental Health, we have 29,000 older adults on our caseload that have a diagnosed mental health issue. We have 9,500 individuals on our caseload that have an alcohol and substance abuse issue. And then obviously things like problem gambling. So that's OASIS. Adult Protective Services is housed within the Office of Children and Family Services. SNAP and HEAP is in the Office of Temporary and Disability Assistance. I could go on and on and on. And so that's why, the way that I think about these things is the more, the better the partnerships I have with those state agencies and their local counterparts, the more that we can leverage assets and tools that we don't provide or the expertise, so that we are serving people holistically, because you don't want to just, deal with whatever the crisis is. And usually for us, it's somebody leaving a hospital that needs a home delivered meal, right? But then you do that comprehensive assessment and you find out, oh no, that's just the tip of the iceberg. So your question is, do other agencies approach their work the same way that we do? I've seen a significant evolution over my time here. I've worked for 4 governors. And it gets tighter and tighter every year. So I would say the answer is yes. The group of commissioners that I'm fortunate enough to work with under the governor's leadership of appointing them, they want to work together. They understand the same types of things that we do. It's difficult to get outside the siloed nature of things because of how things are funded, what the regulations and things are. But yes, I am seeing a much tighter knit group every single year that I'm involved in state government, and that's a positive for families.
Good. Any other questions? Greg, I do have a question that a colleague posed a couple of days ago when we were in the midst of planning. So with many of us engaged in caregiving, especially for parents, sometimes a better scenario for a family is to have a parent reside with us instead of going into a care facility or living independently. Yet at the same time, the costs of healthcare can be outrageous. And so there's an imbalance within the family unit, even though they're part of the family unit. So my colleague was actually wondering if you could ever imagine a situation where we move towards being able to add parents almost as dependents onto our own health care.
Yeah, I mean, that's an interesting idea and spot on. I think the average caregiver spends about $9,000 in cash out of their own pocket every year, right? And that's in addition to the tasks. When we talked about housing, one of the main proposals in the housing agenda is to make the zoning changes that allow for like an accessory dwelling unit. If people don't have the room or a tiny house that could be put on the property. AARP has championed a caregiver tax credit for a number of years. I think the idea that you just raised is a little bit different, and I would love to give that some thought. But I do think that there's going to be innovative type ideas like that have to be brought to the table. As I mentioned, it's going to be more difficult for people. We're seeing prescriptions go up, right? Access to care is going to be constricted. It's going to be really, really difficult for individuals, and costs are already high. And then of course, you don't have the dental, you don't have the hearing, and you don't have the eyeglasses on top of everything else. So it's a great idea. I appreciate that being raised, and I would love to look into that a little bit more.
Well, thank you. And anybody else before we say thank you? Greg, thank you so much. You're always so generous with us. It would have been great to have you here, but we'll just invite you to drive up in January or something instead when the snow's blowing, okay?
If it's a Sunday afternoon, and the Bills are playing, no, I'm happy to come anytime. I appreciate you guys. Like I said, your attention, always inviting me. So, you know where I am if you need me, and happy to come out anytime.